Good evening to all delegates and faculties. Today is the fourth session of Yogya webinar series. The last three sessions were much praised. We have been getting a lot of good responses. It's because of all your support that we have reached this far. Today is yet another most awaited session. Day 4 of Yogya webinar series brings to you a session by Dr. Dinesh KS, Professor and HOD, Department of Kaumarabritya, VPSV Cortical. He's always been a gem amongst the Kaumarabritya professors that we have, and today he's enlightening us on the clinical management of neuromuscular diseases in children. I request all the delegates to kindly mute their mics. Now may I invite Dr. Girish Sir, Professor, Department of Kaumarabritya, Srinarayana Institute of Ayurvedic Studies and Research, to invite Dr. Dinesh Sir for today's session.
Respected Principal Dr. Devnath sir, respected our Chief Guest Dr. Dinesh sir, and all our faculty members, dear delegates, it's our honor and prestige to invite Dr. Dinesh sir to this awesome webinar series by Yogya 2023 by our House Surgeons Association. Sir has completed his post-graduation from Jamnagar, Gujarat Ayurveda University, and has presented many papers in national and international seminars. And I have got the opportunity to accompany him in many examinations and even valuations. And it's our honor, sir, to invite you to our webinar series. And it's Kaumarabritya Department of SN Ayurveda Medical College is thankful to accept our invitation. Thank you, sir. I am welcoming you to our session. Once again, thank you, sir.
Thank you, Dr. Girish and the whole crew behind this Yogya 2023 for inviting me for this wonderful session. And I extend my love, gratitude, thanks to everyone. Without much introduction, let me go to the subject because the subject given to me is very vast. The clinical management of neuromuscular disorders. The slides are visible, it seems, in full screen mode. Am I right? Yes. See, it's a broad topic actually. So I am on the clinical point of view, on the management point of view, I am abbreviating all these big spectrum into certain clinical categories. Only then it will be possible to wind up within 1.5 hours or 1 hour of our time. So without having a little introduction regarding the neuromuscular disease, I cannot progress. So neuromuscular diseases, according to its onset, there are several types. In childhood onset, it will be mostly connected to anterior horn cell, peripheral nerve, neuromuscular junction and muscle. All we know, all we have studied this anatomy, like the posterior dorsal and the ventral root and the peripheral nerve and the muscles. So any problem connected to this motor unit, either after birth or before birth, that is the basis of this classification. The childhood onset and early onset. In early onset neuromuscular issues, all our usual problems like cerebral palsy, myelodysplasia, sacroagenesis, arthrogryposis, several syndromes, for example, Marfan syndrome, are coming under this early onset issues of neuromuscular expression. Why I told expression? Why? Because the cause need not be exclusively this spinal level. It can be in the brain even. But usually the neuromuscular diseases the term coined to the childhood onset neuromuscular problems like Charcot-Marie-Tooth, spinal muscular atrophy, congenital myasthenia, muscular dystrophies, and Friedreich's ataxia-like symptoms. So my request to the house surgeons that many of you may not have experience in many of these conditions. For example, I don't know how many of you have seen CMTD, that is Charcot-Marie-Tooth, Friedreich's ataxia, but you may be familiar with the cerebral palsy, SMA, and myasthenia, muscular dystrophies. All these are the common cases in Ayurveda colleges. And I know Dr. Girish is a very powerful practitioner in Kaumarabritya. He might have admitted such several cases in your institution also. So while discussing the cases, if you met with any difficulty in understanding the clinical scenario, you can intervene and you can just unmute and just tell me the ask me the clarification, so that there is no need of finishing the uh, presentation for asking the questions. So the childhood onset and early onset. The peculiarity of these two are almost all the diseases of childhood onset diseases are progressive in nature. Just like SMA, just like muscular dystrophy, as the age advances, the problem will get worsened. But in early onset diseases like cerebral palsy, mostly they are non-progressive. As the age advances, either they will better, otherwise there will be static. They will be as such. They will not get deteriorated as the age advances. And in childhood onset, impair motor functions totally and often reduces life expectancy. Majority of the diseases end in death, and quality of life highly impaired. But in early onset, better prognosis, many times manageable. You consider two diseases as an example of this, because I cannot go through the whole diseases of this NMD, but you consider the early onset type NMD, or for example cerebral palsy. You consider a case of cerebral palsy in this group. In this group, you consider a case of SMA or muscular dystrophy, so that you will come to know what is the difference between these two. Otherwise, you will get confused. So childhood onset is progressive. As age advances, the condition deteriorates. Here, no such issues are happening. In anterior horn cells, the classical example is spinal muscular atrophy, our 18 crore medicine disease, very famous in India, not only in Kerala. It is a marketing technique. And it is around 1 in 6,500 cases, rare disease. But in the country like India, it is not rare. And the poor country like India is a good market. Why? Because all Indians are highly compassionate. So either 18 crore people will donate 1 rupee each. Otherwise, a rich man will donate 18 crore rupees from India. Such a donation will not be available in any other country other than India. So SMA is very famous. Even in the village area, if you are asking in the Kerala, everybody know SMA due to this peculiarity. And what is happening in SMA, all of you know. Otherwise, you better know that progressive degeneration of spinal cord by a programmed cell death. Just to clean up the spinal cord, there are certain phagocytic activities happening before birth to remove the unwanted cells. And after removal of the unwanted cells from the spinal cord, one gene should work to stop this function. If that function is not stopped, the phagocytosis continues and the spinal cord will degenerate. This is SMA. CMTD is not a common case, just leave it. Congenital myasthenia, just like the myasthenia gravis, the synapses is getting degenerated by certain mechanisms. In muscular dystrophies, irrespective of the nerves, only it is a myopathy, only the muscles are getting problematic, in uniquely isolated from the neurological perspective, and muscles are getting destroyed. So if you consider all these diseases, we can conclude the symptoms under these five headings. Either the child will present as hypotonia, that means all the joints will be, tone will be less. In case of SMA, tone will be less. In case of hypotonic cerebral palsy, tone will be less. In myasthenia, tone will be less. There are certain conditions in which hypertonia, either in the form of rigidity or in the form of spasticity, tightness, or the tight child. The hypotonia is loose child. Probably a child may present with weakness with wasting of the muscles. Total, the muscles will be wasted. Or sometimes it can be seen that the child will move like this, athetoid type of movement, or choreoathetoid type of movement, or hyperkinetic movements. So there will be a movement disorder. This classification I am putting in front of you just to mention our dosha predominance as well as to select the treatment. I'm not going into the details of each and every disease because that will be wastage of time. You can read it. So altogether, the presentation will be either hypotonia or hypertonia or wasting or the movement disorder, or otherwise a problem in coordination. Can't able to take the things. Otherwise, walking will be difficult, like ataxia. So these five symptoms are very clear. Without these five symptoms, not a single case of neuromuscular disorder can be presented in front of you, irrespective of the diagnosis. So hypotonia, hypertonia, wasting, movement disorder, a problem in the coordination. So Lakshanas are hypertonia, hypotonia, and movement problems, or any combination of these can be seen. Hypertonia and hypotonia can be mixed. Hypertonia movement can be mixed, or hypotonia movement can be mixed. This combination can also be available from the patients. So understanding the hypertonia, hypotonia, and movement disorder is the key business while formulating a treatment or selecting a procedure-based therapy, whether we need to do Udvartana or Abhyanga or what has to be done. For that, hypertonicity means either spasticity, rigidity, or contracture, or a combination of all these. Finally, it will lead to deformity, and this can be called as stabdata, stabdatvam, akriyavatvam, or kubjada, anganam vakratvam, kunitvam, anganam vakrada. So hypotonia or hypertonicity in Ayurveda is Kabhavada Sirasnayu Mamsa problem. Mind it, every drug has its own chair. For example, Drakshadi Kashayam is having chair in Rasadhadu and Raktadhadu. Ashtavarga Kashayam is having its action maximum on Sira and Snayu. Maharasnadi Kashayam, Sira, Snayu, and Mamsam. Punardavadi Kashayam, Rasam, Rektam. Similarly, you should be powerful enough to elucidate the seat of action of each and every procedure as well as each and every drug. To know that seat, you should interpret the symptom hypertonia. It means that Kapha Vada in Sira Snayu Mamsam. In case of Vata in hypertonicity, Vata is doing Sangam, Sadam, Vartam, and Kapha is doing in hypertonic cases, in spasticity or rigidity cases, Kapha is also contributing Sthirata, chronicity, Dirghakalanubandhitam is the salient feature of Kabham. There are certain role of Medas in it. For example, Snayu, if it is the Snayu is vitiated a lot, definitely you should consider the presence of Medas, because Upadadu of Medas is the Snayu. In general cases, I will say one example for a fatty, obese individual with trigeminal neuralgia. You do the obesity treatment so that this headache will come down. Similarly, an obese patient with sciatica, it is a Snayu Vigaram. So reduce the obesity, make the Medas proper, you will get good result in Girdrasi. This is the involvement of Medas that you should keep it in mind. So spasticity is Kaphavadika problem, but more attention should be given to Vata dosha. I hope this is clear. In hypotonia, even though it is Kaphavadika problem, Sangam is there, Sadam is there, making the disease Chiragari, Dirghakalanubandhitam by means of this Kapha, and Kaphavadika, but due to the Siddhala Sandhi Mamsatvam, Saladhangatha, you know, the Prasarana Gunjara Pravarti is contributed by Vyana Vayu. That Vyana Vayu is affected with more Vata, that is spasticity, more Kapha, that is hypotonia. So even though both hypotonia and hypertonia are Kaphavadika in condition, hypertonia is more in Vata and hypotonia more in Kapha. Hope this is understandable to all of you. Now let's see the movement disorder, whether it may be Friedreich's ataxia or ataxic CP, or it may be a fibrillation of spinal muscular atrophy or the fasciculation of neuromuscular degeneration. All these are the movement problems contributed by the spandam of Vigrta dosha of Vata. But unfortunately, many times this ataxia, acetoid movements, certain types of epilepsies are akshebhaga in nature. Even though it is Vata, many times it got good relief with Udvartanam. So I consider clinically, or otherwise my advice to you is that whenever a patient is coming with a movement disorder, whether it may be Parkinson's disease, or it may be a choreoacetoid, or it is a coriform movement of rheumatic fever, or Sydenham's chorea, or whether it may be a Friedreich's ataxia, you do 7 days of Udvartana. In that case, just assess whether the movement is increasing or decreasing. There is no other clinical tool in front of me to give you to previously assess whether it is Kevalavadika or Kaphavadika. I am doing Upachaya Anupachaya. Do Udvartana Ruksha Karma or Dhanyamla Parishayaka Ruksha Karma. Whether the problem is increasing or decreasing, assess within 7 days. Why 7 days? Saptahena Kriya Labhe, Kriya Manyam Samajare. 7 days, minimum 7 days are needed to assess a condition, so that you assess whether the problem is increasing or decreasing. With the Ruksha Karma, if the problem is reducing, it is Kaphavadika. Or if it is increasing, that is Kevalavadiga, shift to Snigdha Karma. Hope this is clear. So my point is, spasticity, Kapavadiga, more attention to Vata. Hypotonia, Kapavadiga, more attention to Kapha. Movement disorder, Kapavadigam, either Kapavadigam or Kevalavadiga. So what is Snayu? This is very important. We are studying it as a ligament or tendons, but in the clinical neurology, Snayu is nerve only. Why? Because Snayu, if you are compiling all the references regarding the Snayu, it can be seen that it is thread-like structure. Snayavaha Shanagaram. This is the most numerous number. 900 Snayus are mentioned. Distributed all over the body from head to toe. The thread-like structure distributed all over the body from the head to toe. Then maximum harmful effect is contributed by Snayu out of all the structures like Sira, Dhamani, and Peshi. Because Nahyastini, Nava, Peshu, Nasira, Nachasantayaha, Vyabadida, Yada, Hanyustada, Snayu Sharirina. And whenever the Vata is vitiated in the Snayu, it will give Gridrasi, Ayama, Kubjara. Gridrasi or Ayamam, tetanic posture, and the convulsive disorders are contributed by Snayu. From all these references, it can be very well understood that it is Snayu is nothing but a nerve here in this clinical context. So stabdata, hypertonicity, and everything is neurological lesion. So Snayu is simply nerve. So main points to be remembered again: Kapavadiga problem, maximum attention to Vata for hypertonicity, maximum attention to Kapha floppy. Dusha is Sira and Snayu. Why Sira came? The Kapha, when it is situated in the Sira, again the Stabdhata is the result. Moreover, you can see whenever the Snayu Vigaras are considered, Acharya always says Sira Snayu Yugata. Because they, even though they are originating from two dhadus, one is from Rekta Dhatu, another is from Medo Dhatu, one is in need of Chita, another is in need of Ushna, one is hot in nature, another is Chita in nature, still Sira Snayu is vitiated simultaneously. Virhitwardam Sira Snayuru. Sira Snayu is simultaneously vitiated. Why? Because they go hand in hand in everywhere. This is neurovascular bundle. Sira Snayu is neurovascular complication. All we know, hemiplegia is nervous system disorder, but it is contributed by a vascular complaint, cardiovascular accident, or cerebrovascular accident. So always consider Snayu Vigara whenever you are treating. Whenever if you are giving two Ushna Tishna treatment, mind it, there is a damage of Sira. Anticipation can be done in your clinical practice. So Sira Snayu is always go hand in hand, including in case of spasticity also. So static problems are, that is early onset problems are mostly Kapavadiga dominant, Sira Snayu Mamsa along with Meda. Medas is not written over here. Why? Because majority of the children are not contributing Medo Dushti. That is why. But in case of childhood onset neuromuscular disorders like spinal muscular atrophy, they are more Vata Pitta dominant. Even though they are contributing, this Vata is contributing towards the Sira Snayu, more they are Vata Pitta dominant because as the age advances, they are getting deteriorated. Sarve vahi vriddhihi prayo adhisandarpana nimittatva sleshmalanugata tad vivarya chakshayo vayuna, then dhadupagam by pitta. So more Vata Pitta dominant problems are there with degenerative conditions. Of course, Sira Snayu Mamsa are the Dushya. These are the two clinical classification. This classification you cannot see anywhere in our textbook. But this is an abbreviation of the total references regarding a Kshayavastha and a static avastha. So Kshayavastha, in this neuromuscular disorder, it is contributed by Sniasr Mamsa by Vata Pitta, and static neuropathies are Kapha dominant. So whenever you are selecting the treatments and while selecting the therapies as well as the drugs, you should be very cautious in this. Because our acharyas always says, Vadaha, Vadahara. For example, Sahajanadi is Vadaharam. But you know, Sahajanadi is Ushna. Belaguduchadi is also Vadaharam. It does not necessarily an Ushna type of drugs. My point is that Acharya is very tricky to abbreviate many our therapeutic phalasrutis. For example, Kashayavasti, Vadahara. Kashayavasti is Niruha. It is Lankana. How can a Lankana can be applied in Vadavruti? So it is Kabhavadahara. Actually, it is Kabhavadahara. Similarly, Ashtavargam is more Rucha in nature. Still, it is Vadaharam. Belaguduchadi is Snigdha in nature. It is also Vadaharam. Adari Sahajaradi is Vadahara, but it is Ruksha. Maharasnadi is not Ruksha. This discrimination you should do in every selection of the drug. Whether the Vadahara is by Ruksha or whether the Vadahara is by Snigdha or non-Ruksha drugs. So this is the classic discrimination between these selection of drugs between in these two conditions. In degenerative condition, we usually select Belaguduchadikwadam, Maharasnadikwadam, Guduchadikwadam, Kalyanagandridam, Ashwagandha, Gokshura. These are the different drugs. Punarnava, Kapikachu. These are the different drugs what we are using in degenerative condition. Whereas in more static problems, static encephalopathies, cerebral palsy-like conditions, non-degenerative condition, Ruksha drugs are getting selected. Attavargam, Adhari Sahajaradi, Resonadi, Villuadi, Sahajaradi, Badhadarvyadi. So, what are the other peculiarities while treating the degenerative condition that you should take care of? In muscular dystrophy, or in myasthenia, or in spinal muscular atrophy, these are the three main cases come across with our day-to-day clinical practice. In that degenerative condition, whenever we are doing Snigdha therapies, even mind it, it is Vadavaitika in nature, as I told you. Degenerative conditions are Vadavaitika in nature. So obviously, we should get Snigdha Upashayam, but unfortunately, in long run, you will not get Snigdham Upashayam, rather it is Anupashayam. For example, if you are doing a Pilichil, Taila Parishagam, in a case of muscular dystrophy, within 3 months, the condition will aggravate. Initially, there will be an Upashaya. Later on, a severe grade of Anupashaya will be the result. Why? Because the Snigdha increases in a Vatapaitika condition only the presence of Ama, Dhadugata Agnimandhya, Ama, if it is present, only then a Snigdha therapy will get Anupashaya in a Vatapaitika condition. Hope it is understandable. So, mind it, because we took near about 5 to 10 years of time to understand this problem. That is why I am sharing this 10 years, by the time of 10 years, whatever we understood, that I am transferring directly to you in front of you, that don't apply too snigdha treatment in degenerative Vadavaitika conditions. So snigdha anubhashaya, you are getting good ubhashaya with ruksha therapy. Mind it, it is Vadavaitika. So ruksha therapy is getting ubhashaya, it means that it is associated with ama. Two ushna conditions will also get anubhashaya. Two ushna is also getting anubhashaya. Why? Because it is vata paitika associated. So the pitta will get aggravation by ushna treatment. Moreover, these two are additional information to you, that whenever you are applying a Vishahara drug like Dushi Vishari or Villuadi Uliga, that biomarkers like CPK will come down. My point is that in a degenerative condition, if you are applying a Vishahara Dravya, obviously you will get Ubhashaya. This is due to a peculiar type of Vishasamprapti is happening in all degenerative condition. We call it as Ama Visham, or it is a type of Dushi Visham. Stidam Rasadi Shwadava Vijitran Karodi Dhadu Prabhavan Vigaran. So all the Dhadu problem, if it is chronic, there is an association of Vishasamprapti in it. So mind it, while applying a therapeutics, while selecting the drug, you try to incorporate either Villuadi Guliga or Siddhisha or Dushi Vishadi Guliga in that, so that you will get a better results. Then the last point I want to mention is that whenever you are applying a Medhya Dravya like Centella Asiatica, Guluji, Manasapitra Patagam, again the CPK will come down. I am telling the CPK why, because it is easily accessible. So an ideal treatment methodology for a degenerative Vadavaitika condition is that it should not be too snigdha. It can be ruksha. It should not be too ushna. And it should incorporate Vishahara and Medhya. In static condition, as I told you, it is Kaphavadika. Vata is in need of Snehana therapy. Kapha is in need of Rushana therapy. So if you are doing Svedana, it is good for Vata as well as Kapha. So how can you apply the Svedana Ushna either with the Snigdha Dravya or with Ushna Dravya or Rusha Dravya only? You cannot purchase the Ushna as such. You can purchase either Jadamayadi or you can purchase Kolagulatadi. Jadamayadi is more Shita and Kolagulatadi is Ushna. Or otherwise, you can have Tailam plus Ushna or Churnam plus Ushna, Udvartana or Abhyanga. This can be selected for heating. So, if you are doing the Shodhana Chikitsa, I am sure you will not get good results in all Shodhana therapies, except in case of Vasti. So, it is very impossible to eliminate the doshas from Madhyamo, Murda Hridaya Vastyadini, Marmanyasti Samdayaha, Tatrobani Baddascha Sidasnayu Kandaradayaha. Because all those are Sthayi Dhadus. Once a Samprapti occurred in the Madhyama Roga Marga, it will be very difficult to eliminate the doshas from Madhyama Roga Marga. So, Shamana is the maximum attention in the form of either in the form of Abhyanga or in the form of Yuktya Vacharaye Sneham Vacha Dhyannena Vastibihi Nasya Abhyangana Gaddusha Murda Karna Architarpanayi, or its opposite functions. So maximum attention should be given to Shamana Chikitsa. So Rukshana, if you are doing, it also causes Vadavriddhi. Snehana, if you are doing, it also causes Kapavriddhi. So go for an alternate Snehana Rukshana therapy karmas in case of static problems of Kaphavadika, just like the cerebral palsy. How can you do this alternate Snehana Rukshana therapy? It is very well mentioned in the Sweda Dhyaya in Charaka Samhita. In several other conditions also, in Kapabadika Snehana Karma, in Kapabadika Sweta Karma, it is very well mentioned that Kapabadam should be managed as alternate Snigdha Ruksha Sweta therapies. So our package is going like this: 3 days of Snehana therapy, then 3 days of Rukshana therapy. Similarly, we will repeat it, Snehana, Rukshana, for consecutively for 24 or 31 days of time. One admission in every 6 months or 4 months of time according to the gravity of the problem. So this is the Snehana Karma what we are doing. 10 a.m. there will be an Abhyangam and Matravasti simultaneously. Abhyangam with in Kapabadikam, the best Abhyangam Dravya is Karpa Sastyadi, which acts directly on the Sirasnayu, or it can be a Kotanchukadi. Matravasti can be given with the Sahajaradi Pipalyadi. At 3 p.m. there will be a Chiropichu by Dandandaram or Karpa Sastyadi. There will be a Shamana Snehana internally. It can be given in the evening time, Vadavai Gakala. And there can be a simple 1 drop Nasya at 5 p.m. So, Yuktya Avacharaya Sneham Bhakshyadi Annena Vastibihi Nasya Abhyanjana Murda Tarpana. These are the methodology what we are using for the Snehana. And its opposite will be given after 3 days. That is, at 10 a.m. instead of Abhyanga, there will be either Uddartana or Danyamala Parishega Sweta or Danyamala Potali Sweta. At 3 p.m. there will be Rucha Shirolepa or Talam. We will not put oil for that. Dasamulam, Sapyastabhanagadam, or any Rucha Drivya can be applied over there. Madhutakapanam instead of Snehapanam. Guguru can be simply boiled and it can be given for Rucha therapy. Instead of Nasya, you can administer powder Nasya, that is Mana Nasya or Pradhamana Nasya, so that every portal will be Ruksha. Previously, every portal will be Snigdha. So this alternates Snigdha Ruksha therapy. This will trigger a contrast stimulus in the brain so that it can produce high end of neuronal plasticity. That is what we need in static problems. Or we know, even the Isaac Newton has never used 10% of his brain. Then what will be a condition of common man? So there are several unused neurons in the brain that can be easily, and with the long run, we can stimulate it to produce new functions. This contrast stimulus has to be applied in static condition. Now let's see what will be the treatment protocol for the degenerative conditions like muscular dystrophy, SMA, myasthenia. All such conditions should be treated with Vata Pitta along with Ama. Vata Pitta along with Ama situated in the Sira, Snayu, Mamsa. So, not Ushnam, because it will aggravate. If it is too much Ushnam like Pidichil, if it is too much Ushnam like Patrapotala Swedam, there are chances of tissue degradation by increment of Pitta. Nadi Sidam, Ama will be increased. No Snigdham, Ama will be increased. It should be Ruksham. Sama Pittam, Sama Vadam can be managed. Medyam, Vishaharam. Finally, you can give certain Ishad Snigdha procedures that I will tell you what are they. Ishad Snigdha. After Rama Vachana, you can do 1 or 2 days of Abhyanga or Desamula Chira Parishega. Desamula Chira Paka you can use very well. It is Vata Pitta Shamana. In that you can add more Vatahara Dravya like Desamula. So, Natyushnam, Nadishidam, no Snigdham, Ruksham, Medyam, Vishakaram, and Ishat Snigdham should be the protocol. The peculiarity of all these drugs are satisfying all these prerequisites. Balaguluchyadi, Villuadi Guliga. You see, Villuadi is applied in the condition Bhujangaludonduru Vristigadhir. Then Visha, Jara, Gara, Ajirna, Vishujiga. You see, Ajirna, Vishujiga, Ama condition, which needs Ushna treatment. Visha, which needs Shida treatment. If the condition is simultaneously coming, Vata Pitta, Pitta along with Ama, so that you can beautifully employ the Villuadi Guliga, because it is simultaneously reduces the Pitta, at the same time it reduces the Ama. So Villuadi Dushi Vishani Guliga, Manasamitra Patagam. This is a great philosophy that each and every death and birth of a cell is governed by its soul and mana and atma. If you want to treat the cellular atma and soul or the mana, you give major drug. Udvartanam with Jadamayadi like Pitahara Dravya, Dashamula Kshira Parishegam, very good Ishad Snigdham, but at the same time, Vada Pitashavanam, it also reduces up to some extent the Amapadana can be done. Abhyangam, very minimal Abhyangam can be given. Shashtika Anna Lebam, not the Shastika Sali Pitasvedam, without Abhyangam, you can do Shashtika Anna Lebam. That is Isha Snigdha. It is Ruksha if it is not applied with this oil. It is Brahmana. It is Vadapitashamana. Then this combination, I am taking an example, whatever I am using frequently, that is Rajanyadi, Avibhati. Rajanyadi, the peculiarity of Rajanyadi, when we compare with Artachurnam and Ingvajadi Churnam is that Ingvajadi increases Pitta. It is not good for long run in Vadapaiti condition like degeneration. But Rajanyadi does not increase Pitta. At the same time, it gives Devana Bhajana. Avipatti for Pitta Samana. Even though we are doing these type of Ushna treatments, there are chances of getting aggravation of Pitta. So Avipatti has to be mixed as a Samana dose. Ashwagandha, Leghu Sandarpana. It is Leghu, Ruksham, at the same time Sandarpana. So Leghu Brahmanam should be the drug of choice. I select Mahishadravagam. Mahishadravagam is an Arkam. Arkam is Leghu. Arkam is very Leghu. But at the same time, it includes Mahisha, Asti, Sira, Snayu, Majja, and Maharashtra Kwada. It is Brahmana. So Leghu Sandarpana should be the best selection of medicine like Ashwagandha, Mahishadravagam. Then gradually you can increase the Brahmana like Yavanavasti. Muhur application of Guduchyadi for the Pitta Samanatu. Muhur means from 8 AM to 8 PM, 1 hourly, 1 tablet or half tablet of Guluchyadi Kwadam each. Sadavari tablet, Ashwagandha tablet, Jeevanti tablet, Gochura tablet. I am applying in every degenerative conditions like SMA, muscular dystrophy, like a condition, at least weekly once, 12 dose of Muhur, any of this drug according to the condition. So my point is, use of complementary and alternative medicine in children with common neurological disease. I'm taking this much presentation time to wind up within 45 minutes because I expect at least half an hour of discussion with you people. Don't hesitate to ask these questions, at least from young children, like young budding doctors like our internists. Why? Because I expect maximum base questions. Probably it may be baseless. Don't worry. Only then I can jump into the practical side of each and every conditions of this. Okay. Then to the young doctors, I will again say, what is the scope of you while studying these neuromuscular diseases? This is very important. After hearing the class of Dr. Dinesh KS, if you are simply sitting and sharing this PPT, nothing will be achieved in your career. If you start to read these type of articles. The use of complementary and alternative medicine in children with common neurological disease. This is Korean Journal of Pediatrics. It is a very good journal. You can see that all over the world, for these neuromuscular diseases, more up to 78% of the people are unsatisfied with the allopathic medications. And these 78% of the people are seeking for something other than that. Where they are going? What they will search in internet. For example, myasthenia, child, alternative therapy or alternative medicine. Certainly, they will reach to Ayurveda by virtue of Ayurveda starts with A. There are several Google search engines which leads to Ayurveda too. By that time, my request to the young doctors, internies, that by that time, you should reach to them through the internet. Whenever they are searching for it, you should reach through the internet in them that there are certain people in Kerala, the cradle of Ayurveda, they are dealing with Ayurveda. There are certain doctors X, Y, Z who wrote certain articles, who wrote certain blogs in the name of neuromuscular disorders connected to Ayurveda. And they are dealing with this Ayurveda and neuromuscular disorders. So my humble request to the young intern is that whenever your professors, whenever your teachers are admitting your in your hospital any cases of this SMA, cerebral palsy or anything like that, you write that case with the permission of your teacher by putting their name too. You write that case and publish it in any of the trials journals or prepare a blog or at least in your social media like Facebook, LinkedIn. You write a review. Keep on writing during your internship period. Finally, a stage will come where every search engine will lead to you. Finally, a mail will come, or here there is one tab. What is that? Other information. If somebody is clicking in that other information, they will get how to connect with you. This is the only option in front of you to show that you are familiar with Ayurveda, is familiar with neuromuscular disorders in front of the global population. See, utilization of complementary and alternative medicine by pediatric neurology patients in Saudi Arabia. Why I put this article? Why? Because Saudi Arabia is very near to Kerala. Many people are ignorant about the alternative system, but very good number of percentage of people are fond of Ayurveda in Middle East. In this article, more than 80% of the Saudi people and UAE people and Middle East people are searching for alternative therapies for their kids' condition of pediatric neurology. Why can't they come to SNAC? Why can't they come to your clinic? Why can't they come to your college? Simply speaking, this is the methodology what I am using during the days of my 2010 or 1 decade ago. I have used several times this methodology and many queries are coming. And my humble request to you people that by taking BAMS, nobody will give you employment. Many BAMS holders are unemployed. But The global population is in need of Ayurveda. Only problem is that there is no connection between BAMS holders and global population. Many people from the globe is in need of Ayurveda, but BAMS holders are not connected to them. There should be a bridge. That bridge should be writing or speech. So my humble request to the young doctors that do scientific articles, plenty of people will come to know. Otherwise, blogs, a strata of people come to know. Otherwise, you do English videos or Hindi videos, not necessarily Malayalam videos. Post it in YouTube by putting these keywords. Then you write a common man's article, the article what we see in the case of Arogya Masiga or Manorama Arogyam. Similarly, there are several such health journals in Japan, Germany, Europe, US, UK. Search it. It is there in your mobile. It is there in your mobile. Submit an article. Why can't you publish it? Simple article if you have good English knowledge. If you don't have that much English knowledge, hire someone by paying. If you are paying 1,000 rupees for writing, definitely will come as dollars in your clinic. Or do the seminars like this. You can conduct seminars, public seminars. Do the presentation like this. My point is that don't do whatever your predecessors done. Not everything is right in previous generation. There are several rights, but not everything is right. So think different. Don't follow ajaras. Unique brain is with you. Use it. By this, I am winding up. Thank you. Thank you very much for these wonderful opportunities. And let us have some discussions. Only then it will be fruitful. And I invite everyone to make one or two questions regarding this theoretical perspectives and the practical applications. Once again, love you all, especially to the crew behind this Yogya and the faculties in Sniasr for inviting me for this wonderful program. Thank you very much.
Thank you so much, sir. We couldn't have thought for anyone else who can take this class with such grace. For all this minute detailing that you have done in the presentation and the effort that you took to put forward this wonderful, wonderful session. My thanking wouldn't be enough. So may I invite Dr. Rakiman, Associate Professor, Department of Kaumarabritya, Sri Narayana Institute of Ayurvedic Studies and Research for the same.
Good evening, sir.
Good evening.
I hope, sir, you remember me. Thank you, sir, for what a presentation.
Yes.
As always.
I am familiar with Raki madam. Yes.
Okay, thank you, sir. So, as always, such an inspiring presentation. I should say that such an inspiring, knowledgeful, vibrant, and moreover, it was a unique presentation. Sir, thank you so much, sir. And sir, how beautifully sir has explained the each and everything in an inspiring way, I must say. Even the basics of the subject like hypotonia, even that also sir has explained very beautifully in the basis of doshas and all everything. And moreover, sir is inspiring each one of us for or motivating us to the next level like that. And your dedication and your years of research and your depth of understanding, sir, and your ability to present the topics in such an interesting manner, sir, that made us a very proud and a memorable day in the Yogya Vidya series 2023. Thank you, sir. And I'm sure that all the delegates are enlightened with the knowledge sir has shared and with his crystal clear explanations and his concepts, very new concepts, everything, and of course his presentation style. And on behalf of SNIASR, I thank you. Thank you so much. I wholeheartedly thank you, sir, for accepting our request and coming over here and presenting such a vast topic in a limited time. And all I can say that we are looking forward for organizing another event with you, sir, in the near future. Hopefully, you will accept it. I wholeheartedly thanking you, sir. Thank you so much.
So no questions?
I think this series is open for discussion. Delegates can unmute yourself and ask the questions, or you can put it in the chat box again.
Without question, I am not happy.
Yeah.
Shall I call someone? Tirtha KC.
That will be better, I think, sir.
Is it any student's name, please?
Yeah, Tirtha KC. House agent.
I could get some question from the students. House urgents. SNAC is a powerful college. I expect 1 or 2 questions from the students.
Good evening, sir.
Good evening.
Sir, I would
Switch on
like to
your
ask.
camera, please. Otherwise also, okay, tell me. Yes, ask me any
Sir,
simple question from your understanding.
Sir, could you please explain the use of thalapodichil in neurological disorders in children?
Yeah, actually, whenever thalapodichil is used, primarily the shira is manipulated. Shira is the seat of both prana and udana. So prana and udana functions are Tata prano murdanyavastitaha kantorashchara buddhi indriya hridaya mano damani dharana stivana kshavadudgara praswasa anna pravesadi kriya. So anna pravesa, for example, if a child is cerebral palsy, unable to swallow the things or always dribbling of the saliva is there, to reduce that you can use this thalapodichil cha. Or otherwise, if a child who is suffering from any frequent gastroesophageal reflux disease, frequent vomiting, you can apply this. Similarly, if you want to improve the attention level, you can use this thalapodichil. Drugs can also be changed like pittasamana or kapasamana. If it is dribbling of the saliva, which one I have to select, Tirtha madam? Which one I have to select, kapasamana or pittasamana? If dribbling of saliva is there, in thalapodichil, which dosha has to be considered, kapasamana or pittasamana? I am keeping vata as such. Then whether I need to do ushna treatment or sida treatment in thalapodichil. Dribbling of saliva is there, prasegam or abhyavaharanam is not there. Okay.
Sir, I think it is kabaharam.
Yes, that is the simple logic. So I will use dashamulam sapnyasthabanaganam in takra for shirolabam. Great. Any other questions, please?
Thank you, sir. Thank you so much.
All the best. Any other question, please? Anusari Prasad. If I am calling, that will be great. Probably I am remembering my own student life also. At that time, everybody will be hesitant, but nowadays it is less. Everybody should ask the question. It should be a blunder. Could you please explain the Nasya medicine in degenerative cases? Very good. Ashwadi Komalan. See, degeneration means Vata Pittadigam. So Nasya should be more snigdha in nature. So the best medicines what we are using is either Kshira Guluji or Kshirapagam of Guluji or Kshirapagam of Bela or Kshira Bela Tailam. These are the usual medicines what we are using. Ashwati Kaumaran again, thank you. Yes, yes, yes. Okay.
Delegates, please utilize the opportunity to interact with sir.
Which medicine in Pradhamanasya, sir? Actually, Pradhamanam Dhmanam mainly indicated for Kabhadika condition. So, if it is very minimal Kabha dosha, I use our Rasnadi Churnam. There are certain conditions in which too much Kabha dosha, that is means in a condition is there like complication of measles, too much stupor, the consciousness may go. In such condition, I use Vidyuadi Gulika powder or otherwise Siguru Bicha powder like Tikshna Dravyas or Drona Pushpiswarasam like Tikshna Dravyas. There are certain highly Paithika condition in which there will be severe reddening of the eye along with the reddening of the face, fever, along with the movement disorder. In such cases, we use Snigdha Dravyas like Snigdham Pittasamanam like Pravala Basmam. Even the Pravala Basmam we are using for the Mara. Okay. So I am happy with the questions. I feel there is no more question, it seems. If at all it is there, let us discuss. Otherwise, let us wind up, Rakhi madam.
Thank you, sir. Thank you so much.
So thank you very much. Thank you one and all. And a very good night to everyone. Okay.
Thank you, sir.
Thank you so much, Dinesh sir, for this wonderful, wonderful session. Thank you, Rakhi ma'am. Thank you, everybody who has been here today. Further updates regarding the next session will be intimated in the WhatsApp groups. Thank you so much.